As law enforcement officers try to take down those distributing drugs, the PA Health Department is taking a new approach to tackling new issues emerging in the overdose crisis. It's now offering training opportunities on up-to-date topics. It's just one part of the Shapiro administration's multi-agency response to address the opioid epidemic that continues to change. The acting health secretary tells me they want to make sure everyone who encounters substance use in the Commonwealth has the tools they need to reduce the stigma and get people on the path to recovery.
About every 2 hours, someone in Pennsylvania dies from an overdose in Pennsylvania. A lot of that is opioid related, including fentanyl and other issues.
Countless people who work on the front lines of Pennsylvania's overdose crisis now have more tools to fight it. The PA Health Department is offering 5 new training opportunities. Acting Health Secretary Dr. Deborah Bogan says the free virtual courses will give healthcare and public safety workers the tools they need to provide evidence-based care.
We want to make sure everyone has access to quality care with kindness and support.
Each module is geared towards certain people. There's one for those who treat pregnant and postpartum women with opioid use disorder, another for people who work in emergency departments.
To increase their knowledge on key topics related to opioid use and harm reduction, linking people to care, reducing stigma, prescribing buprenorphine, which is a very effective treatment for opioid dependence.
There's also training for child welfare professionals and for dentists.
It turns out that dentists are the most likely healthcare professionals to prescribe opioids for people who've never had an opioid exposure before.
In PA, there were 5,158 drug overdose deaths in 2022, down 4% from the year before. In Allegheny County, there were 692 overdose deaths in 2022, nearly 30 fewer compared to 2021.
We still have a lot of work to do.
Dr. Bogan says training they've provided in the past is still available, and she hopes the information in the new courses trickles down to better patient outcomes and saves lives.
We really need to address stigma so that people can get to recovery and to get the services they need. And so we have to reduce stigma. We also need to keep people up to date with what is new and changing in the crisis. Reach out, talk to people, and get the help you need.
If you or a loved one needs help finding substance use treatment or support, don't wait. Call the PA Get Help Now helpline. It's free and available 24/7. There are many resources across the Commonwealth. We'll put that information on KDKA.com, along with the links to where you can create an account to complete the new overdose prevention training. Anyone can sign up for free.